Hi everyone, my name is Elizabeth Kromm and I'm with Howard County General Hospital, and today I'm here to talk to you a little bit about population health and local population health initiatives. So first we're going to talk about the county's health priority areas, give you a few examples of local things we're working on, and then finally talk to you about how you can take your place in all of this. So this is one of those graphics that I wish I had when I was explaining to my parents why it was that I wanted to have a career in public health instead of becoming a doctor. I think it really nicely sums up, where interests are. So health is really a lot more than healthcare. When you think about what comprises one's health, this is how it breaks down. 40% are socioeconomic factors. So these are all the things such as your education, your job, where you live, all of that. Your physical environment, so are you in a place that you have access to clean air, safe streets, the good places to play and be outside? Your behavior, so do you use tobacco? Are you able to have access sort of as a default to healthy food and everything like that? And then really only 20% is about healthcare, so your access to care and the quality of care that you have access to. So when you think about it, 80% of what makes up health is not clinical care. And that's really at the heart of population health efforts, the recognition of that, and also the understanding that depending on where you live and who you are and the color of your skin and all of that, that makes a difference in your health. So our health priority areas overall for Howard County, and we go through a pretty rigorous process to develop these. It's actually a really good example of collaboration across different entities. The health department, the hospital, the Horizon Foundation, and the Columbia Association got together several years ago and decided that instead of us all going off and doing our own surveys to understand the needs of the community, we would combine forces and create a biennial health survey. So every 2 years, we would go into the field together to ask a set of questions and be able to then develop our plans from that shared data set. This is also what our local health improvement coalition uses to develop its strategic action plan. And local health improvement coalitions in Maryland, so every county in Maryland is required to have one. Some are more functional than others, but we are very lucky here in Howard County to have a terrific one. It's actually led by the health department, and the hospital is very involved, as well as the Horizon Foundation. And so here are our priority areas. It's access to care, behavioral health, healthy aging, and healthy weight. So I'll share with you a little bit about some of the initiatives that relate to those priority areas. The first is our community care team. And I show this slide with these two images to sort of make the point of why we have something like a community care team. So when you think back to the first slide with the different colors and the percentages of what makes up your health, this is why we need to have things like a community care team. So while you certainly have a care team when you're inside the hospital and you have an acute emergency, such as what you have on the left here with the nurse and the physician, maybe you have a respiratory therapist, social worker, etc. If you're really going to make gains in your health overall and take charge of your health, you need a different type of care team, someone like our community care team. And the picture on the right is actually two community care team members working with a client. And so what we do is we work with those who have a lot of health conditions, so maybe they've got diabetes and heart failure or high blood pressure, and some breathing issues. And we go into the home and we start off with basic clinical things, such as making sure that they're able to take their own blood pressure and learn how to do that. We say, get all your medications out from the drawer, from the bathroom, lay them out on the dining room table or the kitchen table and make sure that we're not taking too much of something or too little of something or not enough, or we're missing a drug. And then we go through, what are the individual's goals for getting better? And then how do we help them achieve those goals? And for some, even though they might not be able to be compliant with their diabetes medication, the root cause of why they're not is because they can't afford it, or they have something else going on in their lives that's preventing them from focusing on their diabetes. So that's what we do. We have community health workers and social workers, in addition to nurses, who make up our community care team. And the whole point of this is to get at the root cause of what's preventing someone from either achieving better health or keeping their health at a good state, and then working together, whether it's resolving clinical issues or working on some of the harder social stuff. Maybe it's they can't afford their housing, or they they're socially isolated. So that's what that community care team does. We've seen really great results from it. We've been able to reduce hospitalizations and readmissions. We've also had high satisfaction from those who go through the program with us. And at the end of the intervention, our clients are better able to manage their health and feel like they know what to do if they have a health crisis, and also have a better understanding of all those other things in life that are, big things to deal with that they also need to make sure they address so they can actually take charge of their health. So we've been doing this for a little over 4 years now, and the community health worker component of the community care team is really key. These individuals are from the community and are just amazing advocates and really great educators as well, and can really bring clients along to improve their health. And what we wanted to do, since we've had such success with this, is share our learning and how we do it with others. And I'm really pleased that we were able to take this to the next level. We've actually received accreditation from the Maryland Department of Health to provide a training program that once somebody completes it, they will be certified as a community health worker. So we are now helping to train a future component of the healthcare workforce. And it's nice that we can do it here in Howard County. It's nice that we can share our knowledge and help to further this very important component of the workforce. So another program we have is Journey to Better Health, and this is a faith health initiative. And faith organizations are really an important part of our community for a variety of reasons, but they're also critical for health of the community. And so we partnered with different organizations, different congregations of all denominations to work together to advance the health of that congregation. We provide screenings and classes. We've focused so far on pre-diabetes and mental health, hypertension and obesity. We also developed with these organizations member care support networks. So basically an army of community companions who can help individuals who have an issue, especially those who may go into the hospital and then after they're discharged and coming home, how to help them from a non-medical perspective, just checking in on them or maybe helping them get groceries, things like that. We've worked with 29 faith-based organizations since 2016. We've screened several thousand individuals, and 2/3 of them, just from a quick screening that might happen on a Sunday afternoon or a Friday, are identified at risk, meaning that they are either overweight or obese. They have the markers to indicate that they're pre-diabetic or they have high blood pressure. We've enrolled over 500 people in classes, and these are evidence-based programs that if you take them and engage in them, they've actually been proven through research studies to help you lose weight, help you gain a better understanding of how to prevent getting chronic disease or how to manage chronic diseases that you already have. We have a pretty strong community companion system with our trained community companions, and this number is higher now, but over 200 and some individuals who thus far already participated in our member care support network. So they've needed somebody and have been matched. So in terms of how this moves forward, we were excited last year to use both our community health worker program as well as Journey to Better Health to form the basis of We Care, which is a multi-county agency effort along with the hospital that's well-being education by community advocates right in your environment. So we train basically community health ambassadors. So it's a little bit like community health workers, only not the full training, and a lot about the social supports and the community that we've done through the Faith Health Initiative. And we've gone into certain communities in Howard County where we know there are hotspots in terms of high 911 calls and a disproportionate chronic disease. And we're bringing in there from training individuals from that community to actually be able to help those who live there too. We also, in light of COVID, were able to utilize our Journey to Better Health infrastructure and all of our partnerships in the faith community to do COVID testing. The health department came to us and needed to expand access to testing in the community, and we were able to answer the call. And between July and December, we were on site at a variety of faith-based organizations, and we delivered over 5,000 tests. So I'm thinking about healthy aging, advanced care planning. So this is about your advanced directive, who's your healthcare agent, and just some background information. You know, only 27% of US adults have really talked with their loved ones about end-of-life care. And we know from, I talked about that Howard County Health Assessment Survey, that biannual survey that our health organizations do together. We know from asking our own county residents that 30% of adults in Howard County reported having an advanced directive. This was in 2016. And when we looked inside the hospital at our own electronic medical record, we found that, again, back in 2016, only 10% of patients that were age 65 or older and had been admitted, so had been an inpatient during that year to Howard County General, had an advanced directive on file. So we wanted to do something about that, and luckily the Horizon Foundation did as well, and they started something called Speakeasy, which is a multi-pronged effort to advance the percentage of individuals in Howard County who have named a healthcare agent and have started to have that conversation with their loved ones about their wishes. What we did on the hospital side is we actually created a position called an advanced care planning coordinator. And this individual goes to the bedside and helps people name a healthcare agent and get to work on their advanced directives. And she'll start the conversation inside the hospital, but a lot of times it continues out after discharge. She's also making sure that we are, if a person does already have an advanced directive, that she's obtaining the document and making sure that it's scanned and uploaded into our electronic medical record. Thanks to her efforts and thanks to the startup funds from the Horizon Foundation, now, as opposed to 10% or less than 10%, we are at more than 30% of inpatients who are 65 years and older have an advanced directive in our EMR. A nice byproduct of this effort was that, you know, when she's going in and having these conversations in the hospital room, family members are often there. And so as a result of that discussion, we've had more than 200 family members who've actually completed their advanced directives as a result of being in the room and participating in the discussion with our advanced care planning coordinator. Behavioral health. So much to do in this area. And from a hospital perspective, you know, there are different areas that we can really make a dent in. And what we've done in partnership with Way Station, which is a part of Shepherd Pratt, it's an outpatient behavioral health clinic. We, several years ago, developed a rapid access program. And this is for individuals who come to our emergency department and they have an urgent mental health issue, but it's not something that requires an inpatient stay. They just need help connecting and getting treatment in the community. And so what we've done is setting up a system with Way Station where we can identify and give that person an appointment within 2 business days with a community behavioral health provider. So that links the person, and then once they're with Way Station under the Rapid Access Program, they have access up to 6 visits, including prescriber visits too. So if there's medication monitoring that has to be done, they are welcome to stay with Way Station if their treatment plan indicates that they need to stay after the Rapid Access Program ends. And we've had a lot of success with this in terms of referrals over to Way Station and just providing another connection point for individuals who really do need help and are having trouble accessing it in the community. We also, thanks to support from the county as well as the Horizon Foundation, have put behavioral health navigators in our emergency department. This is very similar to a community health worker. It's a much shorter intervention, but these folks work with individuals who are in our emergency department who have behavioral health needs, make sure that they're able to connect to appointments in the community. If they need transportation to get there, they help with that. If there are other resources that they need, perhaps they have an unstable housing situation, we work on that. We also follow up after the person leaves the emergency department to make sure that they are connected. We've also been able to work with the health department to bring peer recovery support specialists. These are individuals with lived experience with addiction and substance use disorder in to work with those who come into our emergency department and decide that they want to start treatment for their substance use disorder. So those are all areas in behavioral health that we've been working on. And then just thinking about access to care. This is a very exciting program that we've had for a few years now called Practice Howard. And the reason why we have it is because our county, as most places in the country, we face a deficit of up to 80 primary care providers within the next 5 to 10 years. That's caused by a variety of reasons. One is that we have a lot of primary care providers who are getting close to retirement age. Second is that it is not a profession, when you think about all the specialties in medicine, that pays very well. And when you have docs going into medical school and accumulating a lot of debt, it is not one of the necessarily as attractive specialties as others in terms of what you can do upon graduation. So we worked with the county to develop this targeted recruitment program to bring more primary care doctors into the county. What we've done so far in the past 3 years, we have recruited and have 4 new primary care docs in our county practicing, and we just made another round of awards back in December, and so we have 4 new that will be recruited and joining us shortly across different practices. We did a whole RFP process to be able to identify practices that would then go about recruiting and hiring and building those docs into their infrastructure. And the goal here, through how we've structured the loan repayments and the physician supports and the practice supports, is that we're really trying to make sure that these providers stay and practice for at least 5 years. Our belief is that if they come to Howard County and they're able to be here and care for their patients, but also live in Howard County, that they will become entrenched in our community and not want to leave. What's next? So this is something that we're working on that we've actually been able to launch just a few months ago, Mobile Integrative Health. And this is a multi-agency, multi-community agency effort. And this sprung from an analysis of data from our fire EMS data, so the people who manage our 911 call system, and our own hospital EMR data to find that we had several individuals in our county who were high utilizers of EMS transports to the hospital, and also high percentage of the call volume of EMS. So we identified specific areas where individuals were coming from, the types of issues that these folks had, and really noticed that we need to go in and work with folks to try to get to the root cause of what's ailing them, instead of waiting for them to have to call 911, 8 times in 6 months to be transported to the hospital. So we've worked with Fire and Rescue, the Health Department, the Howard County Department of Community Resources and Services with the Office on Aging, did a whole work group to outline a series of interventions, and we launched our component, which is really a mini version of the community care team, partnered with a paramedic that goes into the home. We launched that back in, I believe, September, and we've already enrolled 12 clients in that. And so it's a mini version of our community care team intervention, but the key is that relationship and partnership with the paramedic that's working with the client as well. And so hopefully I can come back at another time where you'll hear us in a few months from now to talk about the success we've had with this effort. So this is cheesy, but the U in population health. So how can you take your place? What are the things you can do? And I always want to include this in talking about these efforts before Leadership Howard County community, because it's all very important about after you learn of the great work and the great things happening in Howard County, how you can be involved. So the first, and my Vice President of Development would not be pleased with me if I didn't put this up here, but the first is really to give to the hospital. You can support our efforts to improve the health of our community. We do have a population health endowment that you can give directly to support all of the programs that I just mentioned. We have a cancer resource center. We are developing a breast center. We have many other projects, both on programmatically and capital, that you can give to. And I think, as you've seen during the pandemic, we are your community hospital, and there are many things that, many reasons why we need to have a strong community hospital, particularly when a pandemic strikes our country. Next thing is, tell us what your business needs are from the hospital to both improve health and manage health, what we might be able to partner together on and do, or things that you're seeing that we should be aware of that we can, develop a plan to address. The next is to share your experiences with us. We have a number of patient family advisory councils. We have other committees. We'd love to hear your experience if you've had one, positive or negative, with the hospital, but also just your perspective and insight from being a community member. Love for you if you are engaged in a faith community. Would love for you to make sure that your faith community is a part of Journey to Better Health. That is a key way that we're able to grow our reach, and we know how the importance of faith communities for advancing public health goals. The second is volunteer. We have community screening events. You don't have to be a nurse. You don't have to be clinically trained. We have a variety of different tasks that you could do. You could sign up to be a community companion and support somebody who's coming out of the hospital. Even a lay leader for some of our programs, whether it's mental health first aid training or our chronic disease self-management classes, that's a great way to get involved. In terms of takeaways from this presentation, the most important thing I want you to remember is that health is a lot more than healthcare. And when we think about what it takes to be healthy, it is a variety of things, and a lot of that stuff is outside an individual's physical body. It is the environment you live in. It is the policies and the supports and the infrastructure that surround where you live. It is all of that stuff. There are multiple organizations in our community that are collaborating to address health priority areas. And we as the hospital really do feel privileged to be a key partner in delivering the promise of health in Howard County. And we are very fortunate to have such a strong health department, a foundation such as the Horizon Foundation that is so progressive and forward thinking, and other organizations and county agencies such as the Department of Community Resources and Services. Not every county has that. I do want to stress that. We are very fortunate here in Howard County. The other thing I want you to do is name a healthcare agent. Seriously, that is very important, regardless of what age you are. It's very important to get that done and to share your wishes, what you want to happen when you are not able to speak for yourself. And the last one is to find your place in population health. Volunteer, give of your time, give of your talent, give of your treasure if you would like. Just find a way to become involved. And if there are other things you'd like to explore along those lines, it certainly doesn't have to be with the hospital. Would love to have you, but I'm more than happy to talk to anybody offline to explore other opportunities in the population health realm. And with that, that's the end of my presentation. I put my contact information here, and I look forward to talking to you all, I guess, live in person when you have your healthcare day. Thanks very much.